Hey guys, it's Matt Bartram here from Warrior Fitness and Health, and in today's question I've got, Matt, I've got trouble with this joint or that joint, am I still allowed to exercise and train? So this question comes in at least every couple of weeks from an inquiry that comes in saying, can I come to one of your Warrior boot camps? But I've got sore knees, sore ankles, sore back, sore shoulders, etc, etc. So I'm going to answer this question in the style of Martin Luther King Jr. His famous quote once went, if you can't run, then walk. If you can't walk, then crawl. If you can't crawl, do something to keep moving forward. And what Martin Luther King Jr. was basically saying here is do the best with what you've got, but keep progressing forward, forward, forward to get the change that you want. So the short answer is you can still exercise. You need to adapt what you do to suit this circumstance that you've got. So rule one, you've got to go to your GP. You've got to get their consent and their authorization for you to participate in an exercise program. There's a good chance that they will give you a letter with recommendations for your PT and coach, and then you can just pass that on to the instructor that you're going to work with. But firstly, get the okay from a medically qualified person that it's actually okay to exercise with the condition you've got. And you'll find the majority of conditions out there, sort of arthritis, osteoarthritis, rheumatoid arthritis, brittle bone disease, etc. Them illnesses are alleviated by movement and exercise, and you'll actually find that movement, exercise and activity will actually help as part of your pain management. So rule one, go to your GP, make sure you are actually allowed to exercise. Rule two, tell your PT or coach what's going on with that specific joint, what your GP's recommendations are. So a good PT will give you regressions or progressions based on the problem with your joint, especially if they're level 4 qualified exercise referral PTs like myself. They're going to have a good grounded knowledge of that joint and what you can do to help yourself with exercise. Rule number 3, know the difference between training stimulation pain and pain. Okay, so what I mean by this is when we train, we're always going to get some sort of stimulation around the body, the muscles, the lactic acid, the joint, that lets us know that we're doing hard work or physical exercise. That is very different to a pain that is pure pain and it's trying to send you a signal to stop what you are doing. So if you're in exercise, if you're in PT, if you're in some sort of group setting, if you are getting actual pain that you know instinctively is telling you to stop, tell your PT. They're going to give you something different to do, or they're going to tell you to stop what you're doing on that occasion and give you some recommendations. But if it's training stimulation pain, where it's just an effect of exercise, then build it up slowly over days, weeks and months. You're going to get stronger, fitter and better, and that's going to make your joint so much better. So in my Warrior boot camps and with my PT clients, let's say for example I've got somebody who's squatting and they've got a joint problem, I'm going to do super slow squats with them. I'm going to do half squats, I'm going to do split squats, I'm going to do parallel holds, I'm going to do partial squats, I'm going to do eccentric only squats, but I'm going to find a way for them to get the correct training stimulus around what their actual issue is. So I'm hoping that's answered the question for you. Rule 1, GP. Rule 2, let your coach know. Rule 3, know what's pain and what's training stimulation. Hope this has answered your questions. If you'd like to know any more about my work, as always, www.personaltrainertamworth.com, or do a search on any social media for Matt Bartram PT. Please feel free to send me your questions and I'll speak to you all soon.